Okay, this is a review of the Blue Choice Plus Silver $2,500 plan and who it works best for. I'm going to preface this and every one that I do a full review on with the hospitalization coverage is what's really going to hurt in all of these plans, okay? The Blue Choice Plus Silver $2,500 plan is what I call a baseline plan. It's the plan that at a minimum is what I would suggest. Now, there are different situations that may fall in or outside of this, but for the most part, we want to look at this. This plan is going to be ideal for a healthy family that's not expecting any type of deliveries coming up or any type of surgeries, okay? This is your typical family, everybody's healthy, running around, even if you have kids or if you're a little bit older, that you don't have to worry about anything serious going on. This plan, it has a $2,500 deductible. It is a $5,000 for family. Now, the thing that you need to remember when we talk about this plan is if a single person inside your family unit gets hurt, they only have to cover the first $2,500 of the deductible, and then all the different coverages kick in. Or, let's say you had 5 people in your family. If each one of them spent $500 on the deductible, or $1,000 on the deductible, excuse me, that would be $5,000, and then everybody would be covered. So again, this plan works with the individual person can meet the individual deductible, or your family meets the aggregate of $5,000. Now, this plan is a POS, which means it has out-of-network abilities in there as well. And you will see that the deductible is doubled for those. All plans in ACA now have what's called pediatric dental. It's just for your typical checkups and things like that. It'll cover some of the very, very basic things. Don't expect it to have a lot of coverage with it. The out-of-pocket max for this, again, the out-of-pocket max is the total amount of money you would pay in a given year, which includes deductibles, copays, and coinsurance, okay? All of those contribute to your out-of-pocket max. So it would be $6,850 for an individual or $13,700 for a family. Again, a single individual inside the family unit can meet this portion only. They don't have to meet the $13,700. They only have to meet the $6,850. So like I said, if you got hit by a bus, one person would pay the $2,500 and then for a maximum of $6,850. Okay? Or you would have the aggregate total of $13,700. Again, if you use out-of-network providers, you have a higher out-of-pocket cost, okay? So you just got to remember, guys, just because something has a higher out-of-pocket cost doesn't mean that you're going to have to actually pay all of that. You know, the difference of $6,850 and $2,500 is like, what, $4,300 bucks or so? So you would have to spend quite a bit of money in the $4,300 to get there, okay? Let's take a look at some of the other things in here. Again, if you listen to the first one, this plan has a $30 copay to see a PCP. The PCP is your primary care doctor, or what I call the ouchie and boo-boo doctor, okay? Little Johnny gets sick, that's who you go to. To see the specialist, it's $40, okay? This is really important, and this is why I like this plan as a good baseline, because essentially, for all your maintenance of your typical things, it's going to be $30 or $40 depending on what you have, okay? You also have some other benefits such as acupuncture and chiropractic, which is $40 copay per visit. All your preventative items, which is preventative screening, it could be mammograms, things like that, that's all included. There's no charge for that in any of the ACA plans. That also includes any type of your well baby charges. One of the things that you're going to want to remember about that is most doctors' offices don't code the well baby visits or even the preventative stuff appropriately. So you're going to want to make sure that you tell them to code it correctly so you don't get billed for it. That's the one thing that drives me nuts. When I had my my baby girl last year, every time we were going in for the well baby checkup, they were trying to take a copay. It doesn't work that way. The other thing with this plan is you have lab tests, which are $25 per visit. X-rays are $55 as well. Again, all for participating providers. This is a great plan, guys, if everybody's healthy, just for your typical maintenance stuff. It's just copays. MRIs, $250, things like that. Again, that's another really good thing. Additionally, in here, you have an integrated drug plan, which is no charge for your preferred. Your generic drugs are $10 for a 30-day supply, and your $20 for a 90-day supply. Essentially, what I tell people is go to Target, Walmart, wherever, and you'll get it for $4 or $5. Okay. So preferred preventative is no charge. Generics are $10 or less. Your preferred brand drugs will go towards the deductible. So again, it's ideal to make sure that your doctor is giving you the generic drugs if you can take them. Always ask for that. Again, you can see that any other type of drugs that you need that are not generic are going to go to your deductible first, okay? Now, here's where it comes in with your outpatient surgeries and things like that, okay? You're going to have for the facility fees, you're going to have a $300 copay per visit for the hospital, and then, if you are in a non-hospital center, it's going to be a deductible and then $450. So you got to make sure that you're trying to figure out what this is going to be. A lot of times, if you're going to have a surgery, just ask the doctor to give you, to run your insurance, and they'll let you know what it's going to be. Emergency room, like I said, it's $300 per visit after your deductible, but typically it's waived if you have to. Like I said, copay if waived if admitted. Emergency medical transport, deductible, then $40 per visit. Urgent care, this is nice, guys. Again, it's $60 copay. You don't have to worry about a deductible or anything. So in the middle of the night, if somebody spikes a high fever, you can run to urgent care or whatever you have to go to. Again, guys, hospitalization is where all these plans stink. With this plan, you have to pay your deductible first, which is $2,500 for an individual or $5,000 for a family. And then it's going to be $500 copay per day up to a maximum of 5 days, okay? So essentially, if you have a heart attack, think about it, you're going to be spending about $5,000, okay? That's where it's at. If you are going to have a baby in the near future and you have a delivery, you're going to be spending $5,000. So these are the things that you got to think about with these plans. Again, all the hospitalization stinks in all these plans now. There is some mental health coverage in here. It's $30 per visit. If it's a hospital facility, it's $55. All right, so here's the cool thing that you got to remember if you're pregnant. Any type of prenatal and postnatal care for the mother is supposed to be no charge. So again, doctors' offices are horrible with the billing for well baby visits as well as prenatal and postnatal. So make sure that they have that coded correctly so you're not just paying copays every time. If during the delivery, like I said, it's going to be the deductible, then $500 a day up to 5 days. Okay. Other than that, everything else you can go through here. Those are pretty much the primary things for it. You are going to get some you're going to get, for people under the age of 19, you're going to get some basic dental and vision services inside there. There's nothing to write home about, but it is inside there. I'm sorry, pediatric dental, there it is. You're going to get that pediatric dental and some pediatric vision in there. It's nothing to write home about. You can read about it. But again, this plan is going to be ideal for a healthy individual or family unit that just wants to make sure that can handle the out-of-pocket cost. The deductible. The deductible is one of the things that you're going to really have to balance with it. I know it's really high now, and especially with the hospitalization, if something bad were to happen, you're talking about $5,000 or so. However, this plan is ideal and is very good with everything else. It's essentially almost like a copay plan. If you have any questions, go ahead and rewatch this. Otherwise, you can call the office with any specific questions. Thank you.